Okay, this is Dr. RJ Bruno, and for this video, I wanted to talk about my journey over the last 40 years in family medicine. Um, I just recently retired in March of 2023, um, and I had spent 40 years in family medicine. Um, and over that time, a lot of things have changed. I used to joke with my patients that I learned medicine in the Stone Age because it just seems like it was so long ago and things have changed so much that, the kind of things that I learned in 1979 and 80s really didn't even apply anymore. For instance, in the old days, the surgeon who would repair a hernia by taking a scalpel, cutting open the area where the hernia was, reducing the hernia, and then sewing the tear closed, because usually a hernia is a tear of the abdominal wall, and the bulge that people get is actually usually a piece of bowel that's stuck in the area. So the surgeon would open the area up with a scalpel, reduce that bulge, and then sew the area closed with sutures. Problem was that the same things that caused the hernia in the first place would cause the sutures to tear. And so usually within 3 to 6 months, a person had another hernia and they had to go back to surgery again. And this would go on and on, sometimes with multiple surgeries for that hernia. These days, hernia repair is done through a scope. A scope is put in. The person uses a scope to pull any material out of the hernia, and then he takes a rolled up patch of nylon webbing, patches this against the inside of the abdominal wall, and kind of tacks it in place with some quickie sutures, and boom, he's done. The whole procedure may take just a few minutes. And because there's no suture to tear apart, there's no incision to tear apart, a person can sometimes go back to work in a couple of days. So it's a lot different. People, in the days when I first started medicine, if they had a heart attack, they were done. They weren't going back to work. They were lucky if they didn't lose their life. Since that time, we have so many things to treat heart disease now. For one thing, the cardiologist can now slip a catheter into one of the blood vessels, go to the heart, and if he finds that one of the arteries is blocked, he can put the catheter through the blockage, open up a balloon, and basically smash the cholesterol plaque or whatever up against the wall, and then he will take a stent that's made out of a metal that is basically collapsed. He puts it back in the vessel, and when he opens the balloon, the stent stays open to hold the blood vessel open. If that can't be done, they can do a coronary artery bypass surgery. Even if somebody has multiple arteries that are closed up when they have their heart attack, if they can get to the hospital in time, if they are able to have the surgery done right away within a short period of time, they can open up these vessels and the heart damage can be minimal. One of the coaches of the Bears, Mike Ditka, had this done. He had a heart attack. He had the blood vessel opened, and he went on living like normal, basically. Now, Also medications have changed so much. Back in 1942, when the World War II was going on, the first antibiotic was developed, and that was penicillin. Penicillin could treat everything. Um, no matter what the bacteria was, you could give them penicillin and they would be fine. These days, it's a lot harder. Bacteria become resistant to penicillin, where in the old days you might have given, let's say, 10,000 units. Now you might give 1,000,000 units for the same bacteria. And there are many bacteria that you can't use penicillin at all for. So the scientists have had to come up with multiple antibiotics to defeat the resistance of bacteria over time. Also, there are medications that are available that can treat so many different diseases. Multiple sclerosis never had a treatment. Now we have some. Blood pressure was kind of hard to treat. We have that. Ulcers were treated by surgery. Now we give people medication for ulcers. So a lot of things have changed. Things that used to have surgery are done with medication or a scope. Medications have changed quite a bit. They're more effective, less side effects. So things have changed so much over the years. I think the only downside of medicine, and I've mentioned this before, is third-party payers. The insurance industry has pretty much taken over medicine, even though they claim that they're not doctors, because of the way that they pay patients for their treatments. They pretty much tell us what to do. And that's the sad part of medicine for me as I got older, was the fact that I lost control of the practice to the insurance industry. Otherwise, it was a joy to work with my patients over the 40 years. I miss every one of them. Sometimes I'll have a dream where I'm taking care of one of my patients and I wake up and I'm sad because I realize that I've retired and I'm not going to see that patient anymore. So hope this has been instructive, a little bit about what's gone on over the years in medicine.